Good morning, friends. I am Dr. Lakshman Singh Charan. I am pediatric gastroenterologist, currently working as associate professor in pediatrics, Jalan Medical College, Ajmer, Rajasthan. This is our team. These are all the residents. Today we are going to demonstrate the liver biopsy. There's a few points about the liver biopsy, how to do preparation during procedure and the post procedure. So what is liver biopsy? Liver biopsy is to extract a liver content. To extract any liver content, just to look for the etiological classification and to diagnose any liver pathology. The first time liver biopsy was done by Paul Ehrlich in 1883. This is around one century back. So liver biopsy. There is a four method of doing liver biopsy. One is percutaneous blind method, percutaneous USG guided. There is a transjugular method. There is an intravenous method is there, transjugular method. Sometimes laparoscopic liver biopsy to be done. Today we are going to demonstrate about the percutaneous blind liver biopsy method. Usually this method is very conventional and very easy. Sometimes if this is not feasible, like in ascites and some other complication, then we have to prefer the transjugular liver biopsy. So what are the contraindications? The contraindication of liver biopsy is if patient is hemodynamically unstable, then we have to avoid it. If PT-INR is more than 1.6 or more than 2, we have to avoid it. If platelet is decreased more than is less than the 50,000 platelet is there, we are not supposed to do the liver biopsy percutaneously. If any intestinal pathology is there, suppose if an intestinal obstruction, some intestinal pathology is there, we have to avoid it. Sometimes if we are suspecting any tumor which is the hemangioma of liver, so we have to avoid it, percutaneous liver biopsy. So indication of liver biopsy to diagnose and classify the diseases. A contraindication is this. So pre-procedure, there should be some checklist to be there. This is a teamwork. So we have to assign someone for the pre-procedure checklist is there. For that, there are the instruments. This is the liver biopsy gun needle. This is a barred max core disposable core biopsy instrument. Usually there is a different color gun biopsy needle is available. This is using for the liver biopsy, which is 18 gauge, and there the penetration depth is 22 millimeter. This is the color coding is there, which is the pink in the color. So we can identify in a pediatric age group for the doing liver biopsy. This is the pink color barred liver biopsy needle is there. This is 18 gauge and the penetration length is 22 millimeters. So during procedure we will demonstrate how to use it, and there is a multiple prerequisite to be there. The same for the asepsis, and first and foremost thing, before doing liver biopsy, there should be consent. There is a consent to be there. It should be written by the parents if it is possible, because before consent is not required and we have not to do. So this is a relative contraindication if consent is not there. After taking consent, and there is a asepsis techniques and all the availability to be there. There should be proper monitoring is there, lignocaine, midazolam, and all the sedative to be there, betadine, spirit, and then cut tray is also to be. Now we are starting the instruments which are using for that. Okay, so just I need one assistant. Dr. Sukhdevi along with me is a resident, so please open it. What we have actually. So उधर बात कर रहे हैं, उसको बाहर करो. Some person is talking there. We are trying to make asepsis as possible as. So we have this formalin container to be there. The liver biopsy specimen to be sent in the formalin. There should be 2 containers, so we can send for the different purposes. Sometimes if you need immunohistochemistry, then we need the normal saline just to send there your specimen. So you just please open it. So this is our proper aseptic precautions and the cut down tray to be there. Please open it. This one, liver biopsy needle. This is a barred liver biopsy needle. Now I'm going to demonstrate how to use it. So we open it. This is a biopsy needle. This is a lock is there. So we have to, first of all, we have to release this lock. For releasing this lock, we have to dip it, and then this lock has been removed. This is the proper needle. There's a 18 gauge and the depth is 22 millimeter. So how to use? This is the loaded gun. So first of all we have to check it if it is working or not. So this is how to use it. We have to use it like a gun. So by inserting it, then we have to put. This is the process. After this firing, we have to retract it little bit. The specimen to be here. Please zoom it. The specimen to be here, which to be pour in that formalin, and then again we have to reload. So I am repeating again how to use it. This is the gun biopsy needle. We have to insert it at the marking area of lever, and then after loading we have to state it like that and then fire. After firing, there is a retraction from the this portion. So the liver specimen to be here. Specimen, at least there should be 2 centimeter specimen to be there, and we have to pour it. After proper sedation, and there to be marking by this side we are doing, and then we have to load the gun like that. So the gun has been loaded, and now we have to put, and then we have to fire. Okay, just please give support from here. So. Hold it. After firing, we have to remove it, and then we have to check is there biopsy content is there or not. So here there is a liver biopsy content is there. We have to pour in the formalin. Just show it, please. If this content is dip down, it means there is a liver content is there, and if it is not dipping, it means there is a either it is fat or if it is a fatty changes in the liver, sometime in NFLD. If you zoom it, please zoom it. This is that we are suspecting biliary atresia in this patient. Have you saw they seen there is a biopsy content is a little bit of bile content. This is a greenish in color. So this is the bile content. The second specimen we are taking. The listeners, इसको इस्तेमाल कैसे करना है कि सबसे पहले आपको ये गन नीडल लेनी है, उसके बाद में इसको इंसर्ट, सबसे पहले आपको इसको लोड करना है. लोड करने के लिए इसमें 2 कंपोनेंट है, दोनों कंपोनेंट को एक इसको लोड किया, ये गन की तरह है, और ये दूसरे को लोड किया, ये लोड हो गई. लोड होने के बाद में आप जिस एरिया पे जाना है लिवर बायोप्सी में वहां पर एंटर किए. एंटर करने के बाद में इसको स्टेबलाइज करते हुए ये हाथ छोड़ना आपको, और ये शूट करना है. शूट करते ही अंदर में स्पेसिमेन आ जाएगा, बिल्कुल रिमूव कर लेना एज इट इज. आपने रिमूव कर लिया, उसके बाद के अंदर में जो इधर की साइड वाला है नॉब, उसको आप नीचे करोगे तो यहाँ पर आपका लीवर बायोप्सी का स्पेसिमेन आएगा इस कंटेंट में, और इसको इस बाद में स्पोर करना है. ठीक है, एक और ले लें. 3 पॉइंट डालो, एक जना सपोर्ट दो. हाँ, बच्चा मूव नहीं करे, कॉन्फिडेंटली अंदर डालो. पहले फील करो कि लीवर के वहीं पर ही हो. हाँ, नाउ अब डालो, थोड़ा सा अंदर डालो, हल्का सा और अंदर डालो. फायर. एक गोज है पास में, गोज दो, गोज है, पूरा निकालो, पूरी निडल को एक साथ ही, पूरी एज इट इज निकालो, सीधा सीधा दबाओ. नाउ वेरी गुड. कम, एक वाला रुको, पहले वाला इसको छोड़ो, इसको नीचे करो, इधर वाले. हाँ, नीचे करो, शाबाश. नाउ डू पुट इट, सीधा का सीधा पुट करो इसमें, हिलाओ, इसको हिलाओ ताकि लीवर कंटेंट बाहर नहीं. हाँ, यस, वेरी गुड. This is the liver content. Are you making video? Okay. So this is the liver content. This is a greenish in color. So you can, by movement, you can feel it. This is your liver content. This is greenish in color. Patient is look like biliary atresia. Okay, oxygen is going on. So after procedure, just after procedure, they are vital to be monitored every 10 minutes, 15 minutes and 20 minutes, followed by 1 hour. The oral to be allowed after 2 hours of procedure. Vital monitoring to be done. After all, we have to give thanks to your team. In our team, Dr. Vijesh, third year, Dr. Sukhdev is becoming third year, Dr. Priyanka, Dr. Anmol, and the person behind each and everything is Dr. Radhakishan and our beloved residents. And you can give thanks to me also. I am Dr. Lakshman. Thank you so much.
Thank you, sir.
Just Dynaplast.